What's up, everybody? It's Steve the Hurricane here, and as always, super fired up and motivated to be speaking with you on this webinar right here that I wrote just for you in what it takes to have a strong finish to 2024. And I love these webinars. I love doing these free webinars. A lot of the stuff, not a lot of stuff, everything that I'm going to be showing you today comes from the most recent active insights or activated insights. I think it's active insights. So active insights, for those of you that don't know, is the new company name from Home Care Pulse. So a lot of you know of Home Care Pulse. They've been around for the last 12 to 15 years now, and during that time they always put out the new benchmark study. Well, they recently added a whole other suite of services, and they're doing things for assisted livings, they're doing things for home health, they're doing things for hospice as well as private duty. And so as a result, they've changed the company name, but still the active insights, the Home Care Pulse benchmark study just came out only a week and a half ago, and I have lots of stuff to share with you from that report. If you have not received your copy, I highly recommend that you get your copy. If you haven't purchased it yet, get your copy of it, because all of the insights in there, they literally have gone through over 100 different insights, and I can't say enough good things about it. And so that's where the basis of this comes from, because as I go through it, whether you realize it or not, the year is half over. Like, it's crazy when I look at the calendar and it is July 16th, right? It's July 16th and the year is half over. So it's like, all right, I'm running as fast as I can. I'm doing everything I can to grow and scale my business. And, well, yeah, but the year's half over. And if we don't adjust certain things now, the year will not finish the way that we wanted it to. And there's a lot of things that we're dealing with. I mean, it's an election year, which you don't have to be, a rocket scientist to know that. But there's a lot of uncertainty as to what's going to happen later on this year. There's a lot of uncertainty with the economy right now, depending on who you speak to. Some people say the economy is bad. Some people say the economy is good. I kind of think it's more in the middle, and I think it depends on who has the resources and who doesn't have the resources, and that's why you hear different stories and takes on the economy. But one thing is true is, from the Home Care Pulse report, from what's going on, and I could even share this with my own company, Home Care Evolution, right? Our phones are ringing off the hook with people contacting us to help them with the sales and marketing. We have other aspects of what we do. We do recruitment, retention, we operations support, all facets of scaling and growing the business. But the number one thing people are coming to us for is help them sales and marketing. Whenever I see that as an industry authority, that says to me that people are having a hard time getting customers and converting customers into paying customers. And why is that an issue? Well, with the economy and the uncertainty, people are watching every dollar that they spend, and so they're not just throwing money at things like they did in years past. Now all of a sudden it's taking a little bit more of an effort to convert people and a little bit more of an effort to get big top paying customers. Or really, what is a top paying customer? A patient that needs a lot of help to sign up with services. That is something that I'm starting to see as a trend going on right now. So as we're getting started here, let me go ahead and share my computer screen. All right, I'm going to jump right into it. I got some announcements and stuff that I'm going through, but I want to just be mindful of everybody's time. At the end, I'll do a Q&A. So first and foremost, just to make sure everybody can understand me and hear me, if you can hear me in your panel where you signed in, the GoToWebinar panel, do me a favor, if you can hear me, go and type yes in the questions box right now, just so I know that everyone's got the audio and can hear me. Awesome, you guys are fantastic. Love you all to death. Great, so let's just jump right into it as I see all these people saying yes. So now I know if anybody says, I can't hear you, it's on their end, it's not on my end. So what it takes to finish strong 2024, right? And the first thing I want to do is just share with you all about the Millionaires Bootcamp that's coming up in October 9th, 10th, and 11th, St. Louis, Missouri. You can go to my website, homecareevolution.com/bootcamp. All things scaling and growing your business, all facets of it, and this is owner-focused event or executive-focused event. As I'm going through it here, you see all of these sponsors. So some of the key highlights in this event, besides all of my topics, we actually have a high-powered executive from Merrill Lynch coming to speak on tapping into resources to help you get your business to $10 million in revenue and beyond. Even how to scale it to $100 million and all the finances and things that are at your disposal. That in and of itself is worth coming to the event. We have other speakers coming in. One of our clients who generated over $20 million in private pay revenue last year, went from $11 million to $20 million in 3 years. He's going to be talking about managing business development professionals and the effort it takes to bring in that kind of leads and so much more. So, I can't wait to see you at the event. Get your tickets. Right now, we're having a special. You get a rapid results kit for free when you purchase a ticket. All of these wonderful sponsors help me to keep the ticket price low. You go to other 3-day events, it's $1,700 for a 3-day event. Ours is still only $999. That's because of our sponsors, so I'm very grateful for them. They're also the ones who helped me advertise this webinar that I'm doing right now. So let's jump right into it. You can always register for the Millionaires Bootcamp now. Go to homecareevolution.com bootcamp. But the first thing I want to talk to you about is understanding your profit and loss statement. So this is now the 4th year in a row that I've seen the same data coming up. And it is something that always raises an eyebrow. So understanding the Home Care Pulse, understanding the activated insights, the active insights, that this whole benchmark study here, they break every single agency down into segments of revenue. Businesses that are doing, I call this under $1 million. The average revenue of the person doing less than $1 million survey did 300 grand last year, right? These are your newbies. These are our struggling agencies, right? Then you have the $1 million to $1.5 million group, where the average agency surveyed, or the median agency surveyed, did just over $1.1 million. Then you have over here the middle of the pack of the agencies surveyed, the $1.5 to $3 million range, where the middle of the pack median revenue was $2 million, which I'm going to come back to that in a second. But then you have your leaders, the people who have agencies that are in the upper echelon. These are folks that are doing $3 to $5 million, and the median revenue of the people surveyed here was 3.6 million. And then last but not least, you have your masters. And the masters are the people who have businesses over 5 million in revenue. From a financial standpoint, they're considered a mid-sized company, and their median revenue for the masters was 7.6% revenue, 7.6 million in revenue. I apologize. So what is this here, this middle column? These are all care related to paying caregivers. All things involve recruiting caregivers. All things sales and marketing to get patients to sign them up, and then all of your operating expenses, excluding owner's salary, right? The compensation that the owner pays him or herself, right? The owner's salary, everything you see right here, exclude owners salaries and benefits. So everything operating the business minus what the owner pays herself, right? So when you look this up here, in the middle here, all things monies paid for compensation packages, including benefits and everything else, to caregivers. Okay, got my little calculator right here. So we're going to take 61.1% goes all towards caregivers. 22.9%. 61.1 plus 2.9. That gives us 64% in total. Let's see if I can get that without a glare for you. There you go, 64% in total. Then we go to the sales and marketing and add that in, which is 5.4, which brings us now to 69.4, right? And then last but not least, let's add 23.9 for your operating expenses. So the profit margin last year went down. So 93.3% expenses on a $2 million business. So if I were to take $2 million, right? $2 million, multiply that by 0.933, that means I spent $1,860,000. $1,860,000 minus $2 million. That means the owner of that company made $134,000 last year. Now, $134,000 is not a little bit of money, but for a $2 million business, $134,000 is a small amount of money. It's less than 10%. 10% of $2 million is $200,000. Ideally, our profit margin should be closer to $400,000 unless we're a nonprofit business. And even if we're nonprofit, you still have to have revenue coming in. But if you are a for-profit business, on a $2 million business, profit should be closer to $4 million. This is something that every single owner listening needs to take a look at and monitor closely. There's a lot of things that you can do. Matter of fact, you can read an article that I put out in my Home Care Evolution magazine last year. It was last summer, I wrote an article in the magazine. You go to homecareevolution.com/magazine. You can access the archive of all of them. But last summer, I wrote an article on 4 tips to improve your profit margin. One of the tips was increasing your rates. The other 3 were things that you don't have to do financially that can help you. Here's also some other data that I'm going to continue to go through with you now that can help you to increase your profit margin by being more efficient. So the first one is taking a look at how many hours per week am I billing out for every single scheduler on my company, right? That's what a care coordinator is. As per when you read through the methodology, a care coordinator is essentially a scheduler, the person who keeps the schedule, manages the caregiver's schedule, assigns cases, etc. Scheduler, care coordinator, interchangeable. That's the terminology as per Home Care Pulse. But if you see, the median agency, the middle of the pack agency, has one care coordinator scheduler for about 775 hours. But then you see agencies that are up here where they have 1,300 billable hours to 2,500 billable hours per scheduler care coordinator. I will tell you, these businesses are far more profitable than these businesses down here at the median or lower. So take a look at your billable hours. How many hours is your scheduler managing herself, right? So if I have one scheduler and she's only managing 774 hours, I need to either increase my hours or change the way that I'm doing things in my business. Now, how do I increase my hours without having to get into the scheduler? You have to look at your average billable hours per week per patient. This is the most important thing. When I look at KPIs, I look at KPIs all the time. I have a Lead Academy call later. I'm actually going to talk about KPIs on that call later on today. My Lead Academy are my top clients. When I look at billable hours per week per patient, that's where I can see if a business is profitable. At the end of the day, a scheduler can really only manage about 40, maybe 50 caregivers' schedules. Like week in and week out, making sure all 40, 50 of those caregivers are working. That's about the max a scheduler can handle. So if my billable hours per patient is 20 hours per patient, and I have 40 patients, which is a maxed out scheduler, 40 times 20 patients, that's 800 hours. That's my median number that I'm showing right here. Now, on the flip side, if I had the same 40 patients, but they were average, same 40 clients, same 40 caregivers, but they on average were billing out and working 40 hours per patient, now I'm at 1,600 hours for the same 40 caregivers working, which means that my scheduler, now she's still doing 40 caregivers schedules, but the business is at this range between 1,300 and 2,400. That's a more profitable business. same number of staff to manage 40 caregivers, but one business has twice as many hours as the other. This is where our marketing effort has to come in. So what does it take to finish 2024 strong? It takes bringing in high need patients. For those of you who know what I talk about, I call them nerds, great need, elderly, resources, disabled, right? Nerds, need, elderly, resources, disabled. When you bring in patients that are high need, high hours per week per patient, that makes the business more effective. That makes the business more profitable with the same amount of staff, because it still takes the same amount of people to manage 40 caregivers one way or the other. But the one where you're building out double the hours is the model that works. This is where we should be striving to be per hours per scheduler in our business. The next KPI I want to go over with you. And so this kind of goes back to, again, efficiencies. Well, these are things that I can do to finish this year really strong and increase my revenue and increase the profit of the business, right? Tracking every single inquiry. This is something that, like, this is a 5-year look back. 2019, 20, 21, 22, and 23. 5-year look back. Over the course of the 5 years that have just passed, there is a variance of revenue between the agencies that are tracking every single inquiry versus the ones that don't. This is huge. This is something that you can do starting tomorrow, the very next inquiry. This is where you invest in inquiry training. This is where you invest in conversion ratios, and you look at your conversion ratios, which we'll come back to in a second. But if you're not tracking your inquiries, I mean, look at the revenue difference. You literally are I'm going to say a lower agency to a mid to low agency versus a middle of the pack $2 million agency. I mean, look at the difference in revenue. This is 1.3, 1.4 million for the average agency surveyed that doesn't track every inquiry, as opposed to the ones that do. They have $700,000, $800,000 in additional revenue. That's almost 60% additional revenue. So how can I finish this year strong? If I'm not tracking my inquiries, begin tracking your inquiries. This is going to help you to increase the revenue coming into your organization. Moving forward, now that I'm tracking my inquiries, what are our actual conversion rates? And this is all stuff that we go over at the boot camp. This is why I keep talking about the boot camp. And we got all of our sponsors are coming to the boot camp, and we can help you with software. We can help you with recruiting. We can help you with virtual assistants. We can help you with all this other great stuff at the boot camp. But it all comes from knowing your metrics. So when you look at your metrics, and what I love about inquiries and conversion ratios, you don't have to be a master to have a 50% conversion ratio. But I can tell you, if you do run your business the way the masters are running their businesses and converting at 50%, someday you're on your way to becoming a master size business. So you could be a business that's doing under $1 million today. If you get your inquiry process down, track them, have a sales process, you go out, screen people, sign them up, close them face to face, and sign up and convert. Your conversion ratio goes to 50% like the masters. You will grow your agency, and one day you will become a master agency. My agency years ago, Care Choice, right? My agency, Care Choice, years ago, we had a close to a 50% conversion ratio, and we were a $5 million plus agency way back when. So I know that it's possible. And my members of my Elite Academy and my top clients, people that are working with me in advanced training lessons 3 and 4, I teach you inquiry, I teach you conversions, that when you do it, you're going to get closer to a 50% conversion ratio. So what you want to do is take a look at where your revenue is, see where you stack up compared to your peers. But really, even if I'm at 1.3 million in revenue and my peers are doing a 25% conversion ratio, I'm still going to strive to get 50%, because 50% is what I know is possible. And what do I have to do? to get to 50%? Systems, processes, right? You can come to the boot camp and we'll go over all of that. You can work with me and my company. We can help you with that, right? But this is what's possible. So track your program and what you do to calculate it. It's all right here on the screen, but it's real easy. Essentially, it's how many inquiries came in, how many people did we meet with to discuss services, and how many of those started care, right? So the percentage of people who started care divided by the number of people who inquired for services, there's your conversion ratio. Example, 194 starts of care was the average master last year. From 390, 194 divided by 390 gives you 50% or 49.7%. That's how you calculate it. All right. So again, number of people who started care with you divided by the total number of inquiries. One last thing on your inquiry tracking. Make sure that you track every single inquiry, even if it's non-qualified. That is also counted in this figure. Why? Because I go back 3 slides. Remember this right here, the sales and marketing expenses? So when non-qualified leads come into your business, you still paid for that. You paid for that through your traditional advertising, radio, print, etc. You paid for that through your Google ads, your Facebook, social media. You paid for it through your networking events and community, your direct referral marketing. Everything that you're doing sales and marketing wise to generate inquiries, your SEO and your website, all of that stuff, you invest money in all that stuff. So even a non-qualified lead that comes in, still count that as an inquiry because something that you're paying money for generated that lead. That's why you count it in the mix, because you don't want it to skew the numbers. You want all inquiries, non-qualified leads as well, factored into your numbers to get your true conversion ratio going forward. The next one we're going to talk about. It's no secret. Internet leads, artificial intelligence, Google ads, social media, SEO, all these things will help generate leads. But nothing converts at a higher rate than direct referral marketing. Nothing. Nothing converts higher than direct referral marketing. So we have to have our internet leads and all of the above that I just said. It's the 1-2 punch. You have to have that. Direct referral marketing, yeah, we got to get to hospitals, hospice, home health, assisted living, skilled nursing facilities, independent living facilities, rehabilitation hospitals. We have to still get to those type of places. Those are the ones that are going to be able to help you to get 33 to 50% conversion ratio, because 2-3 of those leads convert because the person needs a lot of help and they need the help now. And if somebody refers you and they recommend you, that will always carry more weight than doing a search online and looking at reviews. Always have your reviews, always have your online, but make sure your direct referral marketing is coming up. And you heard me say at the beginning of this webinar, folks, how all the inquiries, we had just last week, 16 inquiries last week. That's a record for us in July. July and August is usually slow for us, right? Because people go on vacations and such. 16 inquiries in 1 week in July during our slow season, that's explosive. What are they all asking for? I need to get more referrals. I want you to write this down, folks. Referrals equals freedom. Referrals equals freedom. I'll even quote one of my competitors, who's also I'm a friendly competitor with, Stephen Tweed. A lot of you have heard of Stephen Tweed, right? And I'm friendly with Stephen. Stephen and I actually had the privilege of having a beautiful, like 40-minute conversation at a conference earlier this year that we both spoke at, and I respect the heck out of this man, right? And Stephen Tweed recently posted some findings with his CEO forum that he has, that caregivers turnover rates are really, really high, and how to reduce the caregiver turnover rate, which I'll get to in a couple of seconds here. And I wrote down on as my comment, I said, referrals equals freedom. The reason why caregivers turn over has more to do with unstable work, inconsistent hours, than it has to do with rates of pay. So when you have a caregiver that goes through orientation, if you don't get her working her set schedule, she either wanted part-time or full-time work. If we don't get that caregiver working her schedule in that first week, when she gets her first paycheck and it's not the schedule that she was signing up for, she's going to quit and she's going to go work somewhere else. Who has the hours? This is where referrals equals freedom comes in, because if you always have a steady flow of inquiries coming into your business, and especially the high need referrals that come from professional referral sources, as you see on the screen here, that will help you to get caregivers working immediately. And when a caregiver has one patient for 20, 40, whatever hours she's looking to work, and it's day in and day out, she's not gonna look for another job because she has a full-time job. She shows up every single day. That client, that caregiver stay together for the length of time for that client's on services. And if it's the right kind of a client, it could be 18 months, 2 years. That's retention. So it's very important that we understand how sales and marketing in this case helps us with the recruitment and retention of caregivers, which moving forward, you heard me talk about making sure that we're bringing in professional referrals. If I want to bring in professional referrals, I need to be speaking the language of my referral sources: hospice, home health, hospitals, skilled nursing homes. All 4 of those top referral source types that I just showed you on the previous slide, they all are concerned with readmissions. And if I want to get professional referrals from parties who have the nerd clients, the great need patients, I have to be holding myself accountable to the same standards that they are, so that I can then come in and show them my metrics and what my readmission rate is, which the national readmission rate for the home care side of the spectrum is only 4%. I can show how by partnering up with me, by working with me, I can help you reduce your readmissions, which helps you grow your census, helps you improve your outcomes, which will bring in more patients to your organization. It's a strategic partnership. All of this strategic partnership, I have an entire presentation at the boot camp on how to create a strategic partnership, right? Phenomenal. You got to come to the boot camp, right? I'm going to teach you and train you how to do all of that. But part of it is tracking your readmission rates. And when I see, again, this is the second time, 2 years in a row, actually it's longer than that, but I'll just say 2 years in a row, that 75% of the agencies out there are not tracking readmission rates. If I'm a hospital, I'm not going to refer you. If I'm a rehab center, a nursing home, I'm not going to refer you, because you're not even tracking you don't even know what your readmission rates are. So I'm not going to refer you. So what is this? How do I finish 2024 strong? Start tracking your readmission rates. Now, you heard me talk about the sponsors for the boot camp. I know SwiftOps, one of our sponsors at the boot camp, they have in their program, in their services, they have the ability to track readmissions for you. I know Ani, which is Smart Care, they're also one of our sponsors. They have the ability to track readmissions in their software. I also know that CareTime Ally, right? They're another software company that also does this. So I recommend all 3 of those. And I'd say take a look at the one that you have and just check to see how they do it and figure it out. And if yours doesn't, make the change so that it's automatically done for you, so that you don't have to do anything special. Just follow whatever your software is doing and start tracking your readmissions, because this is a golden opportunity for you. How do I finish 24? What does it take to get referrals in 2024? Tracking your readmission data is a huge selling point and a conversation piece that will lead you to in-services and lunch and learns and truly becoming a strategic partner. That's what we're trying to do, improve the quality of care of our patients through these strategic partnerships, an interdisciplinary team, as I like to call it, and that's what I train you on during the Millionaires Bootcamp, right? Moving forward, let's continue this, right? Let's talk about the revenue generated per caregiver. This, when the turnover rate is high, which the turnover rate is high, the revenue generated per caregiver is going to go down tremendously. Now, I'm going to be, this is just brutally honest. Anything below $15,000 is terrible. Because think about it. This is not how much money I'm paying a caregiver before they quit working for me. This is how much revenue this person came in, how many hours they worked, and how much revenue was generated for my company during their tenure with my organization. $6,000, $5,500. That has to improve. $11,000 needs to be better. $15,000, because think about it, if you're paying 60, because think about this, Matt, this is the category that I talked about before, right? It's the category I talked about before, that if a caregiver is generating $15,000, that means I've paid that caregiver only $8,000. That's not a full year. That's not even a half a year that they're working for me on average. My turnover rate is very, very high if I'm in these three categories of revenue. Now, how do you divide it? It tells you right here. Here's how you calculate it. Total revenue that you did last year divided by the number of caregivers you had employed that year. $1 million, 100 caregivers, $10,000 a caregiver. Right? $1 million divided by 100 caregivers, $10,000 revenue per caregiver. That's what that is. Look to the masters as the benchmark that you should be striving for. How can I finish 2024 strong? Well, every time I lose a caregiver and I have to turn a caregiver over, that's money and time spent not growing the business, but just maintaining. It's like I lost somebody, so I'm replacing what I lost. If I can keep my caregivers a little bit longer, we know that this is possible. This isn't a great number either, but this is possible. So if my average caregiver can generate $25,000, yeah, my business is going to grow significantly, because as I'm adding new caregivers in, they're all generating $25,000 before they leave. That means I have a better retention program. I'm keeping more caregivers, and it makes sense. The people who've mastered the business, yeah, they probably have a high billable hours per week per patient, which makes it easier to have one caregiver, one client for the schedule the caregiver is looking for and the client needs. That's how you get your average caregiver generating $25,000. But this is an efficiency that you should all strive for. The closer you can get to this number, the stronger your business will be when 2024 ends. That's the whole purpose of this webinar here. I hope this is good. I hope you're getting good insights here. That's why I love doing these webinars where I get to talk about the numbers, because the numbers don't lie. But what do I take from this, Steve? What does this mean for me? When you hear it the way that I'm explaining it, yeah, this is what I should be shooting for as a goal for my company. That's a KPI, a key performance indicator. If I can get to this number, my business is doing much better than any of these other areas below. Moving forward, let's talk about turnover rates for caregivers for a second. And this is all stuff that I go over at the boot camp. I keep talking about the boot camp. You see on every page. Come to the boot camp. I want you to come to the boot camp, right? I even got a free gift I'm going to give away at the very end. I'm going to raffle off something for you, all right? But this is remember I was talking about my buddy Stephen Tweed. He had shared this exact graph, and he was talking about how the turnover rate had increased, and it's going back to this now. Now this one right here in 2018, Home Care Pulse actually went out on a limb and said this was an anomaly year. But prior to, and for about 5-6 years, our industry turnover rate was a steady 65%. The last 2 years, though, it went up closer to 80%. And so now that we see 2 years in a row with around 80%, this is where we have to figure out how we can do things better. The biggest thing that we just said before, referrals equals freedom. The more referrals I have coming into my business, the more likely it is when a caregiver goes through orientation, I can assign her right away. So she doesn't have any downtime from orientation, graduation day to being assigned to a case the very next day. She's not looking for another job because she's working right away. When a caregiver's client discontinues services, my ability to get that caregiver working on another client the very next day or maybe 2 days after that one ends, that's imperative. So in order for me to be able to help retain my caregivers, I need steady work. Referrals equals freedom. Now, how do you calculate your turnover rate? It says it right here. How many caregivers quit and or were terminated, because sometimes we fire caregivers and you have your reasons, I know. But when that happens, how many caregivers did we get rid of or quit in a year divided by the average number of caregivers that we had employed during that same period of time? That gives us the turnover rate. So how many people quit or were terminated divided by how many people on average did we employ during the same period of time. This gives us our turnover rate, and the industry average right now is 80%. Moving forward, another thing that we can do, and this is where, again, referrals equals freedom. This is where, again, having closing processes. This is where, again, stuff that I will go over and teach you, systems and scaling processes at the Millionaires Bootcamp. I will go over this stuff in training at that event. Will help you to be able to do this. This is where it comes down to caregiver compensation, how much money you are paying your caregiver. This is the most, this is a huge variance. This is the first time it was this much of a variance. If you are paying in the top 25%, meaning like you're the 75th percentile, right? The upper echelon, if you are paying the most, the top 25% most paying, your turnover rate was just under 50%, 45%. If you are paying in the bottom 25%, the lowest paying bracket, you literally had 100% turnover. Every person that you hired left. Which you think, how much does it cost you to get one caregiver? Oh, one caregiver in today's economy is about $600 to get one caregiver. So if I hired 100 caregivers, that's $60,000, and all of them turned over. I just wasted $60,000, or I didn't waste it. They worked a little bit, but I didn't even keep anybody, which means I have to spend $60,000 just to maintain my 100 caregivers. Whereas if I had the same $60,000 to get 100 caregivers a year from now by paying in the upper echelon, I still got 55, 56 caregivers still working for me, and I can spend another $60,000 this year and get another 100 caregivers. That's efficiency. That's working smarter, not harder. Okay, Steve, I get it. Paying more money. I want to pay my caregivers more, but I can't charge more. Sales and marketing, right kind of inquiries, referrals equals freedom. You could do all these things when you have the abundance of referrals. This is why I want you to come to the boot camp. But again, look at where you are compensating your caregivers compared to your marketplace. I mean, literally, what's this, 50%, 55% difference, right? In your ability to retain caregivers. That's tremendous. Moving forward to the next one here. How am I doing on time? Okay. I'm doing real good on time here. We're going to wrap up in the next 10 minutes or so, and then I'll take any questions that you have, Q&A, and I'll raffle off a giveaway and stuff. Let's talk about the size of the business, all right? So your office staff, and when you look at your office staff, this is where, like, my goal with this, what I'm about to say, is not to downsize and terminate positions. It's just making sure that you understand the profit margin of your business. I will say that if somebody has all of these positions, this is way too high. I don't know why anybody with a business doing less than $1.5 million does not need all of this staff. This is way too much staff. It's way too much. I'm not saying get rid of anybody, but you better be vamping up your recruitment and your marketing if you are in here with the goal of deficit spending now, have the right people in place and grow the business. And you better finish 2024 strong. If you have this many people working for you and your business is doing less than $1 million, you really shouldn't have more than 4 full-time employees, including you yourself. So 3 full-time employees and you if you're under $1 million in revenue. It's about 1 person for every 250,000 in revenue. Really, if you want to write down a real good goal, what I prefer, closer to $350,000, $400,000 in revenue per full-time employee. That's what I recommend. And if you look at it, it makes sense. Look at your masters, right? Even look at your leaders, right? Look to the leaders and the masters. The masters, they have probably 1, 2 full-time sales reps, 3 administrative staff, 2 executives, like a chief operating officer type financial or marketer or clinical officer. Those are your executives, right? And then they have the field supervisors, 3 of them. That makes sense. Usually nurses or care coordinators going out and managing the caregivers and supporting them. And then 1, right? A dedicated intake person, right? So 1, oh, and four schedulers. That's what these are, schedulers, right? So 4 schedulers, 3 field supervisors, let's say 2 business development professionals, 3 administrative staff, and then 2 executives, right? So I just named 14 people, and the average master, because this is the average master, did $7,600,000 last year, divided by 14. Man, look at that. That's $550,000 per full-time employee. No wonder the masters are so profitable. $550,000 per full-time employee. That's what that just worked out to, right? The numbers don't lie. This is why I love doing this. So there you have it. You really can get your business efficiently going if you have $550,000 per full-time employee. You got a $2 million business and 4 full-time staff members running it. That should be a profitable business, right? This is what these staff look like. But if you have 4 or 5 full-time staff members and you're only doing $1 million, that's too low, right? So just take a look at how many staff members you have and what you're trying to do. Now, I will say I understand. If I'm over here at this $2 million range, well, if I want to get to $3 million, I might have to bring in another person, right? So fine. This dedicated intake person, I don't know why anybody would have somebody whose job, sole responsibility is just to jump on leads. This should be a shared responsibility with the sales rep. Just going to just go out there and say, as your consultant, there's a freebie for you, right? The salesperson should be the person who's the dedicated intake person, because they're developing relationships and then they're following up on leads that come into the business. That just logically makes sense. All right. Scheduler, yep. These smaller businesses, you only need 1. The admin staff, you only really need 1. And sometimes for a smaller company, the executive management office manager can be the same person. Same here, can be the same person. You don't really need to divide it until the business is doing over $3 million in revenue, and that's when you're over here. All right, obviously you are the active owner in this case right over here, but just be careful with how much you are spending when you're in these lower levels here. If you're going to have this many staff members, make sure that you have a high volume of revenue per patient, a lot of hours per week per patient. You're going to need it if you have this much staff in there, but really try to keep it until you get to this range here where you have 1 person for each of these. That's the smarter way to do it. That you have my blessing, right? But the goal should be about $400,000 in total revenue generated per full-time employee. That's a good goal to shoot for. 400K per full-time employee. Eventually the day will come where you'll be like the masters and you have a $500,000 in revenue per full-time employee to manage it. But let's crawl, walk, run. 400,000 per full-time employee. That's a smart metric to be shooting for. And so that has it. We're at the end of our webinar here. I want to be quick and to the point, 45 minutes. Don't want to waste your time with it. But again, I would love to see you at the boot camp that's coming up in St. Louis. It's already selling out. I think we've already had like 65, 70 people have tickets already, and there's more coming to it. And about 150 is all that we can have between the sponsors and my staff on top of it, which makes about 200 people to it. These are the dates of the boot camp. Again, it's October 9th, 10th, and 11th. And so you can go to homecareevolution.com/bootcamp. If you buy a ticket this week, you get a free rapid results kit. What is in the rapid results kit? You get a 1-hour coaching session with one of our coaches. You get the $5 million blueprint, a business plan on how to generate $5 million in revenue, how many hours, how many referrals, how many caregivers, conversion ratios, all that included, how much it's going to cost in spending to generate $5 million, everything all broken down for you in that blue business plan, $5 million business plan. That's huge. You get the training on Power Partners, how to create the beginnings of creating an interdisciplinary team to help you grow your business and provide better service for your patients. You're going to get the Art of Closing, which is a conversion program on how to close people at an above average price. So remember, I talked about if you're paying in the top 25 percentile, you will retain caregivers significantly better than underpaying caregivers. Well, how do you do that? You need a closing process. That's included in the Rapid Results Kit. You also will get in the Rapid Results Kit the schedules. If you are a full-time business development person, if you're the owner doing the marketing, if you have a part-time marketer, what the schedule should look like, what marketing initiatives they should be doing week in and week out, all included in here. And you also get a free ticket to the boot camp. So this whole thing right here is $2,700 worth of programs, material, and everything absolutely free when you buy a ticket to the boot camp. You go to the website right there and do it. So now, questions and answers, type your questions in. But I also would like to give away one of these for all of you who stayed live with me. We had a lot of live folks. We actually had about 25–30% of the registered people participate live, which is high. Webinars usually don't get this high of a result. So where it says questions right now, I want everybody to type a number 1 through 10. 1 through 10, type a number where it says questions now. I'm going to write a number down here on a sheet of paper, and then I'm going to hold it up. And whoever the first person who wrote that number down, go ahead and do it. Put the number in. Whoever wrote down the number first is going to get the prize. So let me just go ahead and see. I got a whole bunch of numbers up. I wrote it down. And so the person who's going to win the Rapid Results Kit, I picked number 9. That's the number. And the first person who did the number 9, let's see as I continue to go through here. Scroll down. I saw a 9 go up. Daniel Williams. Daniel Williams, you wrote number 9. You're the first person. A bunch of people put number 9, but you're the first person to put number 9. So I want you to email info@homecareevolution.com. Dan Williams, info@homecareevolution.com. You get your free Rapid Results Kit from us. And so now, if anybody has any questions, type your questions in, and I'll answer your questions. Is this recorded? Yes, it is recorded. If you email info@homecareevolution.com, you can get the recording, and they will gladly send that to you. The Rapid Results Kit is free with a bootcamp ticket. So if you buy a bootcamp ticket, you get it for free. So Eureka, that's what I would do. Go to homecareevolution.com, buy a bootcamp ticket, and you get the Rapid Results Kit for free with it. All right. So no other questions. So this is fantastic. Well, everyone, as always, we have a lunch and learn, but the hospital only does webinar. So we have a lunch and learn, but the hospital only does webinar. So what I would recommend, and I think what you're saying is, should we move forward? Definitely move forward. All right. Definitely have the webinar with them. Right now, what I would recommend you do with this, Dan, is I would recommend that you work with your power partners to get one-on-ones with the key contacts at the hospital, the director of case management, the director of social services. You got to get to those folks in person. Work with your home health, work with your hospice counterparts, reach out directly to them, do the webinar for the whole group, and book a meeting from a meeting. One of the things I love to do, because when you, especially Dan, you just won this. So you'll have the sales presentation binder. When you do your webinar, you can actually talk about, here's our company, here's what we do, here's how we do it. And then say to the director, hey, would you like to know exactly what I do when I meet with a prospective client to sign them up? This way you feel more comfortable with me and my billing practices. Book a meeting from a meeting for a one-on-one with that director of case management, social services. Go in, show them your sales process face to face. You need the connection with the top. Once you get in with those individuals, director of case management, director of social services, those individuals will then help you get to know the appropriate people who can refer you the most. They might even allow you to not bend the rules, but they might allow you to come in and bring in breakfast or lunch to meet with a couple of those people, because even though it's our policy, they say it's their policy to not do it in person because they don't want to be inundated. But once they know, like, and trust you, they will do things for you that they won't do for other people. Next question, Wanda, with the web bootcamp access by Zoom. No, unfortunately, we only do the boot camps live in person. I used to do the webinar. I used to try and record it. The cost of live stream is so expensive that it would add to the cost of the ticket significantly. So what I would recommend you do, Wanda, is come to the event. And if you can't come to the event, you can always purchase the recording of the event afterwards and watch it over and over again. But I will tell you, there's a huge difference between going to a rock concert and watching a rock concert on TV. When you watch a rock concert on TV, yeah, it's good. You go to the rock concert, you're sitting there with your lighter and you're swinging it back and forth because it's amazing. So I would recommend coming to the event. Another question, if we can't make it to the boot camp this year, can we roll over the tickets next year? Yes, that does happen. Stuff happens. We understand all tickets are final, but we do understand that stuff happens. I've had people with death in the family. I've had people that a crisis came up, the state walks in or whatever. We will allow you to transfer your tickets to another boot camp within the 12-month period. We always do 2 or 3 boot camps a year. This one in particular is the Millionaires Boot Camp. So I want everybody who's with me live to know that we do different boot camps. So if you came to the one in Baltimore earlier this year, that was the Home Care Evolution Boot Camp. Different set of topics. This particular one is the Millionaires one. This is high level, scaling your business, creating an interdisciplinary team, creating care coordination, increasing client longevity through the care coordination model. This is going to also incorporate picking up referrals from social workers and getting social workers to refer you. This is going to have a lot of presentations around building and scaling a home care business to 8 figures in revenue and beyond. You heard me talk about our guest speakers who are coming in from Merrill Lynch, tapping into financial resources to help you scale and grow your business, private equity, all of that good stuff. And then also hearing from people who are running $10 million plus agencies and how they scaled it. So it's a very high level. So if you have a $2 million agency, $1 million agency, a $3 million, a $4 million agency, you need to be at this event. You want to scale and grow it, you need to be at this event. This event is definitely for you. If you're new, why do you come to this event? You come to it because, I mean, ultimately you want to grow your business, right? So it doesn't hurt you to know what people who are where you want to be, what are they doing and how to get there. So that's why I also recommend it as well. So there you have it. Great questions from everyone. Thank you for asking so much about the boot camp. I can't wait to see you. So that's it for now. But again, thank you all so much. I appreciate you so much. Like I love doing this. This is my 12 year. I mean, I'm working on. I just had my 12-year anniversary, so we're now in the beginning of my 13th year doing this. It's just incredible. It really is incredible. You all inspire me. You keep me going. It's amazing to see when I go marketing. I've gone marketing with members of the Elite Academy recently. And when I go marketing with people, the very techniques, the strategies that I did myself 20 years ago now, 20 years ago, I'm an old man. 20 years ago, when I used to do this firsthand, it still works. And not only does it still work, it's actually working even better now than it did then, because so many people have gotten away from direct referral marketing that when you show up and you start talking about working together in an interdisciplinary team, they're all like, yeah, we're trying to do that too, and we don't know who to work with. So like you're literally walking in at the right time, the right place. And that's how you get those nerd referrals. That's how you scale your business. I have been helping my clients grow their businesses for over 12 years now, and we've helped them generate billions of dollars during that time. And man, they have taken care of over 1 million additional patients during that 12, 13 years of me doing this. And so I just, I can't wait to see you. For those of you who've never been to one, you have no idea what is in store. I know there's other conferences. I know there's association conferences and stuff, and they're good. Not going to discredit them. I'm speaking at half of those too. But the boot camp is where it's at. There's no single event that is focused on scaling and growing your business better than the boot camp. And anyone who's been to a boot camp will tell you it's like a Tony Robbins event. I'm not patting myself on the shoulder. It's the energy. It's the content rich with the motivation. It recharges your battery. It helps you to see what's possible. The successes. I love I have so many people who are up on stage speaking about what they're doing. These are my clients. They're coming to the event and they're living everything that I just shared with you here, watching these KPIs, focusing on them, and they're all scaling their business. The same thing can happen for you. So I hope to see you. To all my sponsors, thank you so much for promoting this and sponsoring this. I'll put that slide back up again. One last chalk. If you need anything, you need internet SEO, Google AdWords, you got to go with Grow Home Care Marketing. Merrill Lynch, you've all heard of Merrill Lynch, right? Engage is a caregiver recruitment and retention program out there. Digital Champions helps you to take your integrating video into your marketing efforts. Swift Ops is one of our tornado level sponsors. Software company Ally Care Time is another one of our sponsors in the software space. Advantage Recruiting Group. If you need executives, you need a business development professional, you need a CEO, a COO, a clinical clinician, you want to talk to their headhunters and they help find the right people for you. This is one of our newer ones. I am not sure exactly what they do, but they support owners somehow, some way. Career Plug Evolve is a recruiting and retention service out there that my company actually partners with. That's why it's called Career Plug Evolve, where we have written over 25, 30 different job postings for all positions into the Career Plug database platform, and then you place our ads, and we're marketers, right? We know how to sell. The person who's using Career Plug Evolve has 300% more inquiries for employees, caregivers than standard level of Career Plug. 300%. I'm not kidding. So if you want a Career Plug, you can info@homecareevolution.com. Hey, the Career Plug Evolved. We need more caregivers. Career Plug Evolved. Info@homecareevolution.com. We can help you with that. CeeLo is a communication point company that helps you with your making sure that all communications between caregiver and staff is HIPAA compliant and private. Huge liability, low cost, worth every penny. Ascension Business Solutions is a virtual assistant company. There's a lot of folks looking, you want to save money, you got to add a scheduler to your already existing scheduler. Bring in a virtual assistant for half of the price of a scheduler, and she's working underneath your full-time scheduler, and now you got two schedulers for 1.5 cost, right? Care Crown is a retention program that I have heard amazing things from my clients about to help them retain their caregivers. DII Home Healthcare gives you customized coverage for your caregivers, benefits packages and whatnot. We gotta offer it. It's out there. And then last but not least, Ione, which is formerly SmartCare, is another one of our software providers. And again, they can help you with managing everything. These are our sponsors, but I can't wait to see you at the Millionaires Boot Camp. It's going to be incredible. It's going to be a great time. Get your tickets now. Get the Rapid Results Kit for free when you get the boot camp ticket. I'll see you in St. Louis, right? Wait. Meet me in St. Louis, right? An old 1950s production. Meet me in St. Louis, October 9th, 10th, and 11th. Love you all so much. Take care. Have a great summer, everybody, and God bless.